Hello, this is Max Knight, first year student in the Indiana State Doctorate of Athletic Training Program, and this is my evidence based holistic care weekly Task 8 reflection on spine evaluation. Um, so, what I'm going to do in this video is reflect on my clinical practice uh, relating to the spine and back, and so we're just going to just jump right into it here. Overall, how would I rate myself in my spine and back evaluation, and why? Um, on a scale of 0 to 10, I'd probably put it around about a 6, 5 to 6. It's still something I'm working on. I'm trying to get better at. Um, but I don't know. It was always something that kind of freaked me out a little bit in undergrad. There was kind of just like as far as um, special tests go outside of range of motion testing, palpation, all that. The actual tests that roll in and out certain types of pathologies always kind of had me a little mind boggled, just because there's 3 or 4 different tests that have you lift a patient's leg up or flex their hip, which could elicit all sorts of problems from sciatica to disc herniations, nerve impingement. So those are all still kind of things I'm working on, kind of clearing up and understanding the differences between those tests. But it's still something. Even when I do my evaluations, it's not as systematic as I'd like it to be. As far as I still do the history. Get those questions, the observation, your palpation. Then you do your range of motion. But then once it gets to that point where you're doing those tests to rule in and out different pathologies, it's that systematic process. Is okay, we're gonna have you laying prone. Now we're going to be laying supine. Now you're going to be sitting. Now you're going to be standing. It's kind of something I'm kind of still working on, just so we don't aggravate the patient's back pain or symptoms anymore, just from me having them switch different positions over and over and over and over just for another test when I could be doing it systematically. And I just don't think I have enough confidence in those evaluations as well. It's like, I kind of get a little narrow-minded, narrowed in. I have the horse blinders on. I'm like, okay, I think it's this thing, but I still try and keep a differential diagnosis. I just did a low back evaluation earlier today, and I still had the same kind of issue where I had to refer back to the book, my book of tests, which isn't wrong or anything, but it's something I still kind of struggle with a bit, and I wish I had a little bit more practice and more experience with it. I'm sure right now, as we're kind of getting into wrestling season, I might see some more back issues here. But I mean, we'll see. Most of the back and spine issues patients I see are from weightlifting class, where they're doing a lot of explosive lifting, more like Olympic lifting almost, where they're kind of getting into that now. So it may be something where I need to go talk to the strength and conditioning teacher about that. But overall, it's kind of more of a confidence thing, and not getting too overwhelmed with, okay, well, what if it's this type of pathology? What if this is like a disc herniation or blah, blah, blah. I think it's just, a little lack of confidence, a little lack of experience with it. Probably not a lot of reps with it in undergrad. And then, I just need to get some more reps in there. So moving on, what are my strengths within my spine evaluation process? I think, some strengths in my spine evaluation is my palpation. I think I'm really good at getting in there, feeling to the different structures, being able to differentiate. Okay, is this between T8 and T7? Is the pain between there? Is it more on the right side than the left? Is it more the spinous process or the transverse processes? Is it more in the facet joints? And I also think, as far as, the musculature around the spine, things that are more superficial, obviously, as, with most clinicians, they'll be probably more proficient in that as well. And then, it's, when I'm feeling really good about myself, my confidence is really good. I'm able to kind of pinpoint certain vertebrae in a certain area where the pain might be, or the muscle tightness may be from, things like that. Other than that, I don't feel. I mean, I don't have too many strengths with that. I can really think more, unfortunately, with more weaknesses than strengths right now, which I really want to change, because this whole spine back evaluation is probably one of my significant weaknesses here. What are my weaknesses here? So my weaknesses is sometimes I get lost. Sometimes, if I'm not feeling too confident, I will, I'll blank on what vertebrae I'm at. Or, I'll have to kind of go back a little bit and take a few steps back and, pick up where I was before. So I need to start using my landmarks more, like, the inferior angle of the scapula. I start using like landmarks like that. I also kind of shut down a little bit when patients say that they have scoliosis, or I find that a patient has scoliosis, I kind of just don't know what to do. I get a little nervous because I feel like, okay, if I palpate an area a little more intensely, or I put a little more pressure on that palpation, is that going to do something? Or if I recommend a certain exercise, is that going to do something? If I stretch the patient, is that going to do something where it manipulates, one of their vertebrae? I don't feel like I'm too educated on scoliosis to the point where I feel comfortable working with them. So that's kind of something I'd like to work on as well. And then I think I struggle with my manual muscle testing just a little bit, just because there's so much going on, and it's kind of something I didn't really focus too much on through school early on. So that's another slight weakness there. What do I do in my evaluation that I think is most useful in my clinical decision making? I think that I feel very strong in differentiating between, okay, is this pain coming from the musculature, or is this actually coming from the spine? And I think, again, that kind of goes into more of the palpation side of things, assessing the range of motion, and asking the patient, does this feel like it's in a muscle? Does this feel like it's more in the middle? And kind of getting their take, getting a really good history, as far as, is this like an overuse thing? Is this something that's new? Did they feel like a tweak in their back? Do they pop their back a lot? Do they try to? Do they go to a chiropractor? The history, the question side of things is really important in kind of cluing in your diagnosis, or kind of getting a shorter differential going. What areas do I want to improve on? I kind of touched on those a little bit here. I want to be more educated with scoliosis patients. being more comfortable recognizing what vertebrae I'm on, not getting lost, and also building a more systematic approach to my testing to rule in and out pathologies. So again, thank you for listening, and this was my reflection video on my own clinical spine evaluation. Thank you.